As we are aware, Lagos State remains the national epicenter of this disease. As at the 17th of January 2021, Lagos has recorded a total of 41,374 confirmed cases of COVID-19. Of this amount, over 28,452 have recovered and are within the community, while about 9,213 are currently active in the community. Over the past 11 months, about 3,776 COVID patients have been admitted into our various care centers with a registered fatality rate of approximately 0.67%. To date, we have 277 fatality cases. So what's been our testing strategy? One of the greatest hallmark of the Lagos State response has been the state's robust testing strategy. In addition to the 4 public laboratories providing free testing under the public health response, the state has increased the number of private providers under the private laboratory consortium to 20 private laboratories. These laboratories are also providing service to both our inbound and outbound international travelers, work-related activities, or anyone that is curious about their COVID-19 status. The formation of the consortium has significantly increased our testing capacity, with the state now conducting between 2,500 to as high as 3,500, almost 4,000 tests per day. So far, a total of 263,358 tests has been conducted between our public and our private laboratories, with 41,374 diagnosed as positive. This has allowed us the opportunity to target our interventions with precision and ensure the effective use and mobilization of resources. It is important to clarify once again that those that fall within the case definition, that is, have symptoms such as fever, cough, cold, inability to smell or taste, have headaches or general body weaknesses, or those who come in contact with anyone with any of these symptoms may be eligible for a free testing at any of our public laboratories. Isolation strategy. Lagos State recorded a steady reduction in the number of confirmed cases of the virus from July to November last year. This led the state to deploy a lean operational strategy by shutting down some of the isolation centers. However, over the course of the festive season, there was an exponential surge in laboratory confirmed cases of the virus. The positivity rate skyrocketed from as low as 3% on the 1st of December 2020 and went as high as 31% by the 31st of December 2020. Expectedly, there has been a rapid increase in capacity utilization of beds at the isolation center and treatment centers that we have, which has resulted in a significant increase in bed occupancy from as low as 4% before to as high as 70% over the last 4 weeks. This alarming trend has necessitated plans to reopen some of our previously established isolation centers, such as the Indo Isolation Center and the Bagada Isolation Center, which used to be the Cardio-Renal Center. It is our hope that this would support our efforts towards containing the rising case and flattening of the curve in the shortest possible time. Our oxygen strategy. The increase in the positivity of cases has necessitated the provision of a greater amount of concentrated oxygen for the moderate to severe cases on admission at our isolation centers. Over the last few weeks, the demand for oxygen has risen from 70 bottles of 60-liter cylinder per day to as high as 350 6-liter cylinder at only our Yaba mainland hospital. This is projected to even double, as we're expecting that we might have a need to up to 700 6-liter cylinders before the middle of February, towards the end of January into the middle of February. In addition to providing oxygen at our isolation center, the state government has decentralized the availability of oxygen across the state through the provision of 10 oxygen and sampling kiosks. This oxygen therapy and other related services will be provided to patients that require them. I'm glad to let you know that 5 of these 10 centers have been commissioned, whilst the remaining 5 will be ready within the next 3 to 4 weeks. And of course, it's important for us to mention that the 5 that has been commissioned are inside the MCC at Etiosa, the MCC at Alimosho. They are purpose-built oxygen triad centers at Koka Aguda Primary Health Center, at Mushi General Hospital, and Isolo General Hospital. It is our expectation that this sampling kiosk will be easily accessible to residents that require oxygen therapy at the level of the local government and a stabilization point prior to their onward transmission to our isolation center if required. This strategy is to further increase our fighting chance of Lagos residents that have contacted the virus and require oxygen therapy. As a result of the increased demand of oxygen, the Lagos state government has commissioned the oxygen plant at Yaba Mainland Hospital, and we're waiting to receive in the next week or so additional 2. One will be sited at Bagada General Hospital, and the other one with a PPP will be sited at the Lasut Hospital in Ikeja. The one at Lasut should be able to produce about 200 bottles per day. The one at Bagada is about the same size as mainland, so it's about 60 to 70 bottles per day. We're also collaborating with some of our private sector. We've had discussions with some companies that can also help us scale up oxygen production, and we just signed up one, and we're expecting to get between 150 to 200 bottles from that single facility on a daily basis. What's been our vaccine strategy? We're closely monitoring the ongoing discussion by the federal government to procure vaccines for use in Nigeria. We have also opened discussions with various vaccine manufacturers so that when the vaccines comes eventually, we can ensure that Lagosians are well catered for. And so in the meantime, we are developing a strategy to articulate the criteria, the regulation, and the monitoring of Lagosians. We also have what we call a private sector collaboration regarding our isolation centers and our labs. The Lagos state government is actively partnering with the private sector in the management of Covid-19 pandemic in the areas of testing, which I've mentioned, oxygen deployment, as well as the clinical management of moderate to severe cases. This partnership has helped enhance the state response to the ever-changing circumstances of the pandemic. In a bid to further explore the province synergy that we see, the Lagos state government is currently reviewing the feasibility of a PPP for the management of some of our isolation center. It is our hope that this will expedite the reopening of previously closed center and also avail us the benefit of the operational cost efficiencies experienced private sector management can bring. So what we're saying is that we need to expand our reach, our scope. We don't necessarily have to start and end it by ourselves, but with our collaboration and with our experience, we can get some public health, private